Jobs are going to start here and stay here and grow here. And as all the politicians run all over the country and say they're the jobs politician, they're the jobs leader, let's make sure that we ask and answer the question by going to the people who actually provide the jobs, who've actually done the work of taking the risk, having a dream, having an invention, having an innovation, willing to invest, willing to build buildings, willing to add payroll, willing to buy capital equipment, willing to do research, willing to commercialize it here in the United States of America. And when you ask people who do that, who actually provide the jobs, who do those things that will keep a private sector economy growing, there are clear and consistent answers that come back to policymakers. And those answers do not best reside in the minds of the politicians, most of whom have not worked in the private sector or have not done what I'm describing. When you listen to these entrepreneurs, when you listen to these dreamers, when you listen to these designers, the folks who are going to make our opportunity unfold in the future in our economy, they say, first and foremost, Governor or member of Congress or legislator, you got to keep my costs competitive. This is a hyper-competitive national and global market. And as measured by taxes, as measured by the costs and burdens associated with regulation, as measured by the costs and burdens associated with the time it takes to get a permit, as measured by workers' compensation costs, unemployment insurance costs, energy costs, and all of the other costs that come with that basket of burdens or costs that add up to doing business in a city, in a county, in a state, in a nation. How does it compare to the rest of the market, not as measured by the rhetoric of a politician, but as measured by the objective dashboard you can put up and say, how is my state, how is my nation doing against the rest of the world in those activities that we know most matter to job growth? And when you conduct that exercise for Minnesota and for America, we've got work to do. And so this first lesson that I want to share with you is life's pretty tough if you don't have a job. And we got to do those things with strategic precision that are going to stimulate and ignite job growth in this country, not in the public sector, but in the private sector if we're going to have success. Number two, and by the way, in Minnesota, our unemployment rate, as I left the governorship, was about 7%, which is significantly lower than the national average. Our job growth rate since the crash was approaching 3 times the national average. Our income growth in 2010 was double the national average, and our per capita or personal incomes in our state are amongst the highest in the country, and there are many other measures of that kind of growth in my state. The second principle of common sense to return America's dream and America's promise is we got to be responsible, and it's this principle. We can't spend more than we have. You can't do it as an individual. You can't do it as a family. You can't do it as a business. You can't do it as a state by law in 49 states. And we certainly can't do it as a federal government. We have a government now in the Washington, D.C., headquartered here, that took in about $2.2 trillion last year, and they spent $3.7 trillion, with trillion-dollar deficits as far as the eye can see. This is not a matter of right versus left. This is a matter of common sense. It is a matter of 8th grade mathematics. It isn't going to work. It is irresponsible. It is unsustainable. It is reckless. And it will certainly take us down the path that we are seeing unfolding in parts of Europe. Just because we followed Greece into democracy does not mean we need to follow it into bankruptcy. And of course, the push comes, oh, Governor, you know, how do you do that? I mean, it's difficult. The politics are difficult. The rhetoric is difficult. This is difficult. That is difficult. I'll tell you about difficult. As Alan mentioned, I'm from the state of McCarthy, Mondale, Humphrey, Wellstone, Ventura, Al Franken. If we can shrink government in Minnesota, as Frank Sinatra would sing about New York, if we can do it there, we can do it anywhere. So what are the measurements? I was born in the year 1960. Yes, that makes me 50 years old this year. I got my ARP card in the mail not long ago. I did not keep it yet. From 1960 until I became governor, 40 years, 42 years, up to 2002, the average 2-year increase in the spending of my state was 21% for 40 years. There is no way you can sustain that. During my time as governor, now we have it down to about 1% a year. It is a transformation, but it was a difficult transformation. There are powerful forces that wanted to say we cannot reduce our spending pattern. We have to get back to the way it was. We must not reduce government's footprint. We cannot prioritize. We have to raise taxes. And I drew a line in the sand and said, no. We're going to live within our means just like families, just like businesses, just like everybody else. When the economy's growing, if at all 2 or 3% a year, you cannot have government growing a multiple of that. Again, not as a matter of political rhetoric, as a matter of math and basic economics. And so in my state, that principle remains. And I talk a lot about Sam's Club Republicans, and what I mean by that is when you go look into the faces of people who shop at Sam's Club or Walmart or Costco or Kmart, or if you got a little extra change in your pocket, you may go upmarket. But places like that, what you see is people don't have a lot of money, but they're looking for the very best value for the money they do spend. And they're also investing in many cases in their families, as you see their carts overflowing with huge volume-based purchases of toilet paper and Doritos and all of the staples of life, really trying to minimize or reduce the burden they're putting on their family with their shopping experience so that their children and their loved ones can have more opportunity and have their needs of their life met. The third thing I want to mention to you is this common sense principle. People spend money differently if at least some of it's their own money. Now, if you got time in your busy life to read white papers and go to seminars and stay up all night and watch cable TV or read all kinds of journals, I hope you do. Those are really valuable experiences. But if you need a shortcut on all you need to know about government reform and accountability, just do this. On a given weekend, go to 2 weddings. Go to one where there's an open bar, where the refreshments are free and endless. Go to one where there's a cash bar, where people have to pay for their refreshments to some degree. You will see very different behaviors. Now, I said this in New York not long ago, and somebody said, well, who the heck has a cash bar anymore? I didn't have the heart to tell them that in Minnesota we still have the dollar dance to raise money for the bride and groom as we send them off into their new adventure. The point of the story is if you have a system where people get to consume stuff without knowledge or responsibility about making wise choices about price and quality, and the provider has no incentive other than to provide more volume of whatever it is being consumed or given, and the myth is the bill goes somewhere else and it's all free, that is a system that I assure you is doomed to fail. That, unfortunately, is most of government. It is particularly most of our healthcare system as I have described that phenomena. Now, I won't go through it all, but let me just camp on that as one example of many. If you look at what's driving much of government spending for cities, for school districts, for counties, for states, for the federal government, it is indeed the health care issue. It is driving budgets at a rate and pace that exceeds almost everything else. And if we don't solve this problem, really solve this problem, it will take down the country, or at least impair it from within. President Obama stood in Iowa and said he was going to do health care reform with an emphasis on cost containment on a bipartisan basis, and we were going to tackle this issue with particular emphasis on the part of health care that challenges and worries most Americans, which is, am I going to be able to afford it? And he broke that promise. That is not what he delivered to the country, and it is not going to work. So what is the future vision with this cash bar, open bar imagery in the background of this discussion? We need to have systems where consumers, or at least purchasers, are in charge. They have user-friendly information about price and quality, that the providers of the service have incentives to do more than just provide volume, that they have to be held accountable for better results and better health, and that the money is in alignment to those goals, and it is at least in partial control of the purchaser and the consumer, and that they're in transaction with the provider. That is not what our healthcare system currently is in Minnesota. What does that look like on the ground? I'll give you one quick example. We said a while back with our state employees, and they were struggling with the healthcare costs. We were too as their employers. We said, how about a new system where if you choose, you can go wherever you want, but if you choose to go somewhere that's higher in cost and lower in quality or efficiency, you're going to pay more. And if you go somewhere that is better in outcomes and lower in cost or higher in efficiency, you'll pay less. 90% of our state employees, now that they had some even generalized financial skin in the game, noticed, and they migrated to more efficient, higher quality providers. And the premium increases in that program in an astounding way have now been 0% for 3 or 4 of the last 6 or 7 years, and the other years approaching 0%. Almost unheard of in the healthcare market. Why? Because consumers now are in charge. They have information and accountability around price and quality measurements, and we have begun the process of paying providers not just on volume, but better outcomes and better health. The next principle is this. As a nation, if we're not going to be the biggest place, and we're not, we only got 300 million people, and if we're not going to be the cheapest place, we've got to be more competitive, but it's probably true that we're not